Hi, my name is Carolyn Rodriguez, and I'll be describing the temporomandibular joint. I'm now going to demonstrate where the temporomandibular joint is. The temporomandibular joint is inferior to the temporal bone, which is this one, and it is superior to the mandible. The temporomandibular joint is responsible for movements of the mandible. It can be found between the mandibular fossa and the temporal bone. This is where you will see the temporomandibular articulation formed with the mandibular fossa. The condyle is also a part of the temporomandibular articulation. It is this piece right here on the mandible. Depression, elevation, protraction, retraction, lateral excursion. A dislocated temporomandibular joint would look a lot like a depressed mandible and slightly out of place. I wouldn't be able to hook it back on. It depends on the severity. They would hear clicking noises when depressing the mandible. At times, if it is extremely severe, what we would call a dislocation, it's subluxation of the mandible. It would cause painful movements. It would be painful to talk or eat. The subluxation of the temporomandibular joint can be caused by a missing tooth misaligning the mandible to the temporomandibular joint. Grinding, any new habits of how the mandible is being moved can cause the temporomandibular joint to become subluxated. Direct trauma to the mandible may be a cause for temporomandibular subluxation. Depression, elevation, moving along the posterior plane, refraction, and protraction would move along the anterior plane. Lateral excursion